Good afternoon. My name is Tricia. I'm going to be your nurse today. I would like to do a physical head-to-toe assessment, if that's okay with you.
Of course.
Okay, great. Can you please tell me your name?
Leslie C. February 21st, 1989.
Perfect. So before I do your actual physical assessment, I'm going to ask you some questions. If you could please tell me where you are.
Stratford, Connecticut.
Okay. What is the year?
2023.
What is today?
June 9th.
Great. Can you please tell me who the President of the United States is?
Joe Biden.
Okay. Can you tell me from a scale of 0 to 10, 0 is no pain at all, 10 is the worst pain you've ever felt. What is your pain currently?
0, no pain.
Okay. Can you tell me about your last birthday?
I went to the movies with my family and then we came home and had some cake.
Okay, great. So I'm going to ask you some more questions. So if you could please count back from 100 in increments of 7.
100, 93, 86, 79, 72, 65, 58, 51, 44, 37, 30, 23, 16, 9, 2.
Great. So I'm going to tell you 4 words. If you could repeat those back. Apple, car, banana, hammer.
Apple, car, banana, hammer.
Okay. Count back from 20 to 0, please.
20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Okay, can you repeat the last 4 words again?
Apple, car, banana, hammer.
Great, perfect. I'm gonna have you take this piece of paper. You're gonna read the instructions and follow the instructions. Perfect. Okay. Okay, so now I am going to start my physical assessment. I'm going to check your scalp. I'm going to check your hair, your skin and nails. I'm going to touch your scalp. Just want to check for any infestation of lice or any missing patches of hair, any lesions, any masses, anything abnormal, and everything looks good. And then I'm also going to take a look at your face. It's all nice and symmetrical. I don't see any facial drooping, no concerns about that. I am going to now, you can tell me if you feel any pain or discomfort. I'm going to palpate your sinuses. So I'm going to go above your eyes. Any pain here in the frontal sinuses?
No.
And then under your eyes, any pain in the maxilla?
Mm-mm.
Okay. I'm going to touch your temples. I'm going to check your temporal arteries. Great, perfect. I'm going to check your temporal mandibular joint. I'm going to hold right here. You're going to open your mouth twice. Open and open again. Perfect. So now you're going to look at me. You're going to squeeze your eyes shut. Open. You're going to smile. Frown. Puff your cheeks out. Purse your lips. Perfect. Great. So now I'm going to have you open your mouth, close, and you're going to open against resistance. Perfect. Very, very good. So now I'm going to check your eyes. I don't see any swelling in the eyelids. Look up. I'm going to check your sclera, your conjunctiva, nice and pink and moist. Okay, so now with your eyes, I'm going to have you follow my pen light. This is my pen light. You follow it with your eyes. Great. Okay, and then we're going to do what is called looking for accommodation. You're going to follow my pen light. You're going to follow it with your eyes as I bring it towards your face, towards your nose. Okay, great, perfect. I'm going to check your pupillary response, just how your pupils react to light. Ready? Sorry, it is a little bright. Okay. So at this point, normally to test more of your vision, we would use a Snellen chart to test your vision. I don't have a Snellen chart, but what I would do is have you step forward, stand on a specific spot, look at the chart in front of you. I would ask you to read the smallest line of letters possible. You would do this with occluding one eye or the other with an occluder. You'd read off those 5 letters. If you get all those 5 letters correct, I'd have you read the next line and so on until you get a line incorrectly. And then I'd have you do the exact same thing with the other eye and include the other eye. But we don't have a Snellen chart, so that's not happening today. So next I'm going to take a look at your nose. I'm going to go in your nose, look up your nose. I'm using my pen light again. Perfect. I don't see anything occluding. No drainage. I'm going to have you block one nostril, breathe through your nostril, your nose. Perfect. Nice and patent. On the other side, you do the same thing. Perfect. We're going to do a little smell test. Put this under your nose. You're going to tell me what you smell.
Vanilla.
Great. And now I'm going to take a look in your ears, and at your ears, I'm going to look for any redness. Again, skin integrity, no issues with redness or skin breakdown. I'm going to pull up on your penna, look inside your ear, no drainage or excess earwax. Other side. Again, no drainage, no excess earwax. Perfect. We're going to do what's called the whisper test, and I'm gonna stop up one side. I'm going to whisper a word, and you're going to repeat it. Ready?
Car.
I'm going to do this one.
Apple.
Perfect. So next I am going to take a look in your mouth. Open your mouth wide. Okay, you're not nice and moist in the inside. No signs of dryness or dehydration. At this point, with a tongue depressor, I would touch either side in the back of your throat to test your gag reflex. Uvula would pop up as you said ah. Can I have you stick out your tongue again? Tuck right and up, down, to the right and the left. Perfect. I don't hear any hoarseness, any trouble swallowing?
No.
No trouble swallowing. Okay, great. So now I'm going to check your jugular vein distension. I'm going to have you lie down for me. I'm going to raise the bed a little bit up so you're a little more 45 degrees. Okay, now look towards the wall for me. Visually, no distension, looks good. You're looking towards the windows. Again, no distension, looks good. I'm going to take this chance next. I'm going to check your pulses and check your carotids. Perfect. And your brachial side. And your radial. Here, check your femoral, other side of your groin. Here, uncross your feet for me. Check your popliteal under your knees. Other knees, other knee. Posterior tibial. And then I'm going to take your socks off for a moment. Put them over here. I know your feet are cold. Pedis dorsalis. Good. Need this chance also to check your toenails, capillary refill. less than 3 seconds. Perfect. I'm going to take a look at your fingers and your hands too. So I'll check your nails. Again, we're looking for capillary refill. Nails look good. Perfect. And actually, can I see your hands one more time? So this is checking skin turgor. I'm going to check, make sure that you're not dehydrated. This can be a sign of dehydration age. So I'm going to actually have you sit up again. At this point, I'm going to start listening to your heart. Normally you'd be wearing a gown, you're wearing a t-shirt. Whenever you auscultate, you want skin to stethoscope, but in this circumstance, we are not going to do that. So I'm going to listen over your t-shirt. I'm going to listen to your heart first with the diaphragm of my stethoscope. Then do the aorta. Pulmonic. Erb's point. Tricuspid. And the mitral. Great, perfect. And then I would take the bell of my stethoscope now, just to make sure there's no murmurs. That may look your line. Perfect. I'm going to have you lay back down again for me. And then I'm going to take a listen to your arteries, starting with the aorta. Under the sternum. The renal arteries. I would then listen to the femoral here. Perfect. I'm gonna, with the gown up, I'd be looking again for any impulses, any heaves. I'm gonna have you sit up one more time, and I'm gonna take a listen to your lungs. So we'll start with just regular lung sounds. Yep, nice breaths in and out. Breath in and out. Good. Here. Okay. Now, when I put my stethoscope on your chest, you're going to say 99, so we can test for what's called fremitus.
99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Perfect. I'm going to have you turn around. We'll do the posterior, your back of your lungs. You need to breathe in and out nice and easy. Deep breaths. And breathe. Okay, I'm going to go in between your scapula and your spine. so we can get a good listen in and out. Okay, so just like you did in the front, you're going to say 99 when I place my stethoscope on your back.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Perfect. Now we're going to do what's called tactile fremitus. When I put my hands on your back, you're going to say 99.
99, 99, 99.
Perfect. So now I'm also going to test the CVA tenderness, costovertebral tenderness. I'm going to put my hand on your back, and I'm going to tap, and you're going to tell me if you're feeling discomfort.
Nope. Nope.
Perfect. All right, now turn around. Perfect. I'm going to percuss your lungs just to kind of listen to what they sound like when I percuss. And it's a little tap. Okay. Perfect. You can lay back down again. Thank you. So now as I check your abdomen, your GI, I'm going to take a look again. I want to see if there's any visible masses, anything visible, impulsing, things like that. Again, gown would be up. I am going to listen to lung sounds first, only because if you percuss or palpate, it does stimulate the GI system, and you want a genuine sound. You want to listen to lung sounds without any interference. I'm going to start in your right lower quadrant, which is the bottom right of your belly. Great, perfect. Nice, normal, active sounds, which means normal bowel sounds. Now I'm going to do what's called light palpation. You're going to tell me if you feel any tenderness or discomfort.
No.
Okay.
No.
Now I'm going to do some deeper palpation. It's going to go much deeper in. You're going to again tell me if there's any tenderness or discomfort.
None.
Okay.
No tenderness.
Great, perfect. So now I'm going to do some percussion, starting right lower quadrant. Three different spots. Nice zigzag pattern. Sounds good. Beautiful. Any problems urinating, any burning, anything like that? Abdominal pain in general?
No.
Your last bowel movement?
Yesterday.
Okay. Last time you had your menstrual period?
Last week.
Perfect. Okay, so now I'm gonna have you spin your legs around. Sit up for me. Okay. This is the point where we're gonna kind of check your musculoskeletal system, see how that, your range of motion, your joints. So if you could stand up for me. Okay. I'm gonna have you lean, put your head down and back. Ears to the shoulder, other shoulder. Perfect. You're gonna go to resistance, ear to shoulder. Again, Perfect. So shoulders, you're going to shrug your shoulders. Now shrug your shoulders with resistance. Perfect. So you're going to lift your arms into a T. Moving forward. Down. Beautiful. So now put your arms in front of you. You're going to bend up. Perfect. And back down. Perfect. You can move down. And then up. Wrists, sorry, hands. Flip up and down. Move your circle. Perfect. Move your fingers for me. Make fists. Beautiful. Okay. So now you're going to press down with your hands against resistance. Perfect. And up, push up. Great. So I'm going to have you bend your waist to the side. The other side. Maybe touch your toes. Okay, and back up. Perfect. So now I'm going to see what pull your knee up. Other knee up. Perfect. Now against resistance, bring the knee up. Other one. Perfect. Have you sit for me? Okay. So you're going to bring your legs straight out, up and up. Now with resistance, probably push down. Other leg. Up. Push down. Perfect. See. Now with the balls of your feet, you're going to push down against my hands. Okay. You're going to try to pull up. Great. Now you're going to rotate your ankles kind of in a circle. Wiggle your toes. Clench your toes. Perfect. Okay. So now I'm going to have you stand up again. And you're going to walk a few steps on your heels. Great. You can come back on your toes. Perfect. And then you're going to walk across again, heel to toe. Okay, perfect. Come on back and have a seat. You're going to stick your hands out. You're going to, palms up and down quickly. Up, down, up, down, up, down, up, down. Perfect. Now bring your hands up. You're going to touch your thumb to your fingertips repetitively over 5 times. Perfect. Okay, wonderful. So now I'm going to have you stand up one more time. Sorry. You're going to take the left heel and slide it down your shin from knee to ankle. And then the other side. Knee to ankle. Perfect. Beautiful. Okay, I'm going to have you stand still, look forward. Swing, then you're going to close your eyes. Great. No swing. You're going to have a seat back again. Okay, I'm going to have you stick your hands out for me in front of you. You're going to close your eyes. And I'm going to draw a number on the palm of your hand. You're going to tell me what number that is. 8. Beautiful. Perfect. Now I'm going to write a letter on your palm of your hand on the left side.
T.
Perfect. Beautiful. Now you can palms up again.
Mm-hmm.
And I'm going to put an object in your hand. You're going to tell me what that is. What's that?
A coin.
Perfect. And on the other hand, I'm going to put another object in your hand.
A key.
Perfect. Swing your legs up for me. On the bed.
Up.
Ready? A little sensory test. Sorry, I know it's a little ticklish. Okay, now you're going to tell me when you feel sensation. Close your eyes.
Mm-hmm.
Okay, arms out, eyes closed.
Mm-hmm. Yep.
Perfect. All right. Okay, so you can sit back up. Great. And that's it. Thank you so much. I appreciate your time.
Perfect.
And I hope you have a great afternoon.
Thank you.